Hi, I'm Christina, and I want to share my origin story here. I spent over a decade in healthcare as a social worker. I worked in hospice, I worked in home health, I worked in SNFs and hospitals. I moved to three different states from Texas to Pennsylvania to Arizona. I kept thinking that maybe I just hadn't found the right fit. Each new place I would go, I would think maybe this place would be different. Maybe here they would listen, but every room felt the same. I stood up in rounds every morning, calculating not just what the patient needed, but how to say it in a way that wouldn't make me sound emotional. I worded things really carefully so I wouldn't lose credibility. I softened my urgency. I fought just hard enough to not get punished for it. And I watched new social workers that I had trained, um, and the same light would go out of them, and that had gone out of me. They began to say the things that we all eventually do, like they'll never change, or what did you expect, or of course no one could help them. They weren't bad at their jobs. They were just exhausted by a system that wasn't designed to truly value us. And what made it worse is that I kept seeing people online, like tech founders and startups and private equity leaders, doing things that I dreamed of, building programs that looked exactly like the work I had been doing for years, but they had branding, they had apps, they had buy-in, they had budgets. They weren't more experienced, and they weren't even close to the problem. They had something that I didn't. And what I later learned is what they had was leverage. If you'd asked me what I wanted back then, I would have said, I want more staff. I want a better salary. I want a decent office. I want a department that wasn't chronically short. I want respect that I saw handed out to people with far less lived experience. And what I really wanted was this: the ability to speak with confidence and to be taken seriously, not just because I was passionate or had credentials, but because I understood the system, and that's leverage. So nobody really teaches social work about that. I did everything that I thought I was supposed to do. I got the training. I kept up on CEUs. I read The Pedagogy of the Oppressed over and over. I stayed informed on policy and news and taught social work ethics at the University of Texas. I paid my dues to professional organizations. I believed that if I just followed the rules, if I just cared hard enough, that eventually I'd get a seat at the table. But after 10 years, I had nothing to show for it but burnout, guilt, and a creeping sense that I was failing everyone, that I was failing patients who needed more than I could give, that I was failing my own family because I was too exhausted to be present with them, that I was failing my profession because I still couldn't make it work after all this time, that I was failing myself because I knew that I was capable of more. So I thought that maybe going and getting an MBA would be the answer. So I applied, I got into this executive healthcare MBA. But even then, I learned quite a bit. But in our whole curriculum, social work was never mentioned in terms of value. And the only portion of the healthcare finance class that even mentioned care coordination in the text, it showed up in only one sentence, and it was something along the lines of care management isn't a revenue driver, but it supports continuity. That was it. In a $60,000 curriculum, that was the only mention of my entire decade of experience. My whole profession and my entire department all just reduced to one line. So even in the traditional healthcare finance text, I couldn't find myself. During that program, I took a night job, a night shift job, just to survive and get me through it. I worked and on my 2 a.m. breaks, I studied hospital financials, and I was writing about healthcare finance on LinkedIn. And that's when it happened. I posted something about the ROI of social work, and it went viral for me at the time. It got 75,000 views, these overwhelming responses, my DMs blowing up. And I knew suddenly that was the signal that I wasn't alone in identifying this gap. This Also, with the other side of that, of course, it came with the trolls saying things like, it's about the care period, stop turning social work into a business, go get a better job if you don't like it, you can't attribute those savings to just social work, who do you think you are? And honestly, it got to me. I agreed with some of these comments, and I thought that maybe I was the problem. Maybe I shouldn't be writing about this, or framing it social work as a value in that way. And it hit me um, over that time, is that it wasn't the trolls, it wasn't the board, it wasn't the system, it was me. I was over identifying with my license as a social worker without realizing that that license is scope. It's not identity. And that distinction is really what changed everything for me. It became my key to leverage, positioning, and possibility. I realized my license governs what I can do as a clinician, but not what I'm allowed to learn, teach, create, lead. It doesn't restrict me from understanding the business side of healthcare. It doesn't stop me from using data, strategy, and financial storytelling to strengthen the work I was already doing. And here's the thing, you don't have to leave the front lines to think like a strategist. If you want to stay in direct practice, knowing how the money works, how decisions get made, and how to speak the language of executives can help you with securing bigger budgets for your department, advocating for those updated equipment and better resources for patients, justifying new staff positions or expanded programs, protecting your time and your team's energy, and keeping the mission from getting buried under bureaucracy. The business of healthcare is the terrain that we work in, whether we understand it or not. And the more that we do understand it, the better that we can navigate it without losing our souls. So, whether you want to advocate for yourself or your team inside of the system, or build leverage for a promotion or higher salary, or pivot into management, consulting, and innovation, it starts with remembering that your license is scope, not identity. Your role is yours to shape. And your power comes from knowing how to use both the heart of your work and the strategy that sustains it. So I stopped asking, am I allowed to? And I started asking, what is the most high leverage way to use everything I know, all of my skills, all of my background, my experience, the nuance, and everything I learned from those months that I spent writing about the ROI of social work online. And I realized that I needed to leave social work permanently to do the work that mattered most. I needed to completely leave my environment behind so that I could get clarity, instead of thinking of myself as a social worker who understands business strategy, instead thinking like a business strategist who understands what social work does. And that's how I was able to gain the clarity I needed to build a framework to quantify the financial value of social care. But no matter how clean it was, I started hitting the same wall, and that's the attribution question. So everywhere I went, People asked, how do you know that it was social work? Can you really prove it? How do you attribute those outcomes to social care and not something else? I thought that outcomes were enough. I thought the peer reviewed evidence that we all hear about how addressing social determinants of health improves outcomes would be enough. But it wasn't. You can still have the best outcomes and still be dismissed. You can have the best care model and still not get buy in. You can have the strongest department and not get funding. And that's what I knew. I had to test my work at the highest level. I took my model to the highest healthcare actuarial firm in the country. I This was a moonshot. I literally laughed when I sent the email because I just thought there's no way, because these are the people who vet ROI models for major payers and procurement teams across the country. And they actually took my case and they reviewed my model. And after some time, we finally sat down together, and I came to them just with one ask, a single question, and that's, can this model be broken? Um, and it turns out it could, and they did. I faced my worst fear after months of obsession and hard work and sleepless nights. The feedback that I got was, this is a solid start, but it's not enough. It's not written in our language. It's not something that finance can trust. And it stung deeply. It felt like a failure, but it wasn't. They also said, this is still passable for early stage procurement. You can use it to start the conversation. So it isn't the full win that I was envisioning. It wasn't the slam dunk that I thought it would be, but it's a first one. And version 3 is still underway. I'm working towards a bigger, better, airtight one. And in the meantime, I run the Fundable 15, where I spotlight the most investable, financially legible social care programs in the country. I host a podcast that brings clinical insight and business strategy together. I help CBOs, health plans, and startups build solid business cases. And I talk about the one thing that no one ever taught me: you don't have to become someone else. You don't have to abandon the mission, but you do have to understand the market you're in. Thank you for hearing my story. Thank you for doing the work you do. And if you'd like to follow along to see how the rest of my journey turns out, please click on subscribe, take a look at my Substack communities below, the Fundable 15 for market intelligence, and the Frontline Strategist for social workers like yourself. Thank you.